Hi, hello. My name is Eunice Mathis. I am a registered nurse. I'm the owner of Florida Train Academy and also Nurse Brand. So, welcome to my channel. Today, we're going to be discussing the top 4 reasons that I left bedside nursing to become a nurse entrepreneur. The nurses that I worked with thought I was crazy. I had tried to open an assisted living facility. I did a concierge service. So, pretty much anything that you could think of, I had tried to do it in my attempt to escape bedside nursing. So, it's not that bedside nursing is horrible. It's just the long hours, the wear and tear on the body, not having time for self that made me decide at an early age. So I earned my bachelor's at 22. And at the age of 22, I also decided that I needed to create my exit strategy so I can figure out a way to nurse, but nurse differently. So I'm still a nurse. I just nurse a totally different way. So the number one reason that I decided to leave bedside nursing was because of lack of fulfillment and lack of enjoyment, working those 12-hour shifts, the wear and tear on the body. And in addition to that, you have, and everything's not negative, but we all are aware that there's nurse bullying. They say nurses eat their young. Well, they just don't eat their young. They also eat other nurses too. They eat their old nurses as well. So it was just a lot of challenging conditions, and you have patients who are sometimes violent, and then management could also be an issue. So with all that combined, I just decided that working in the hospital was not the best use of my time as a nurse. So after 10 years, I was able to venture out because I had actually put the plan in place. Again, with trying the other businesses, I learned how to market. I learned how to incorporate a business. So if I could be of any assistance to you, please reach out to me. My email address will be below. I do work as a nurse consultant in the Jacksonville area and also remotely. So if I can assist you, just please, shoot me an email. Let me know how I can be of assistance to you so that you can also make this transition from bedside nursing to nurse entrepreneurship. So the number one reason was because lack of enjoyment or fulfillment. The number two reason, those long hours. Oh my God, 12-hour shifts. If you have a bad day, you have a really long bad day. And taking those 12-hour shifts, and it was fine as long as I didn't have a child. But once I had a kid, I felt so horrible about dropping him off at dark at 6 o'clock in the morning. I'm dropping him off to the babysitter, and then I don't pick him up until 7:30 or 8 o'clock at night. And I dare not hug him because I didn't want to put those, dirty germs, dirty uniform on him. So, I'm treating him as if, he's contaminated. But meanwhile, I'm not providing the care. I'm giving more care and love to my patients than I am to my own son. So those long hours was another reason why I was, especially once I was a mom and a single mom, I decided that I need to have more control over my time. And I veered away from clinical or bedside nursing. So number two, those long hours, they did me in. The third reason why I decided to transition from bedside nursing and become a nurse entrepreneur, but so that I can focus on myself and focus on my family. You are aware that you can't really take the days off. If there's an event, a family gathering, you can request it off a month in advance, and you it still may be denied. You can't get holidays off. So, oh my God, I have a kid. I'm a nurse, and I can actually be present in the moment with my kids. So, just having that being able to do that self care, that emotional well being, I think that's so important, and it allows me to be a much happier nurse. I won't tell you my age, but let's just say that I didn't age as fast as some of the other nurses have aged. So it's really important for me to be able to provide my son with me. We provide our patients, we give them all day long, but when you go home, you're depleted. So the third reason why I decided to leave bedside nursing was so that I can give more of myself to myself and also to my family and friends. And then the fourth reason that I decided to veer away from bedside nursing and become a nurse entrepreneur is the financial freedom. I made a lot of money as a traveling nurse, and I had nothing to show for it. I made a lot of money as a per diem nurse, with nothing to show for it. And I remember being, in my mid to late 20s, and seeing some of the other nurses who were expecting to retire be unable to retire because the stock market crashed and they had all of their investments, their 401ks in the market, and they had to work, an additional 10 years. And I did not want that to be me. So, in addition to the long hours, not being able to take care of self, not spending time with family, I had to figure out a way that I could create a legacy for my son. And I was thinking about that legacy even before he was ever born. So creating a family legacy. I have a small business. I can give the building, I can recreate the systems and franchise if I wanted to. So just being able to have control over my finances. If I don't want to work, I don't work. If I need extra money, I can teach 2 classes in one day. So, don't be afraid of humble beginnings. It's okay to start small. I had a lot of nurses talk about they made sure they emphasized it, my little business, but that little business has been going now for 12 years and it's still going strong and it's still growing. And I have dozens of affiliate instructors and we train thousands of students per year at Florida Training Academy. So do not despise the days of humble beginnings, and it's okay to fail as long as you fail forward and you learn from your mistakes. So again, my name is Eunice Mathis. It's been a pleasure speaking to you. I'm the owner of Florida Training Academy and also Nurse Brands. Please like and subscribe. And if I can be of any assistance, if you need some nurse consulting, if you need some assistance with your business plan, your business vision, I'm here to assist you. All right, take care. Bye.